If you or someone you know is struggling with Achilles tendonitis, this video is for you. Achilles tendonitis, or more likely, Achilles tendinopathy, is a problem that's characterized by pain, tenderness, and inflammation around the Achilles insertion on the heel bone. Unless it's early on and you have active inflammation, you probably don't have the itis or tendonitis. You're probably dealing with the tendinosis. If you actually have tendonitis and it's early on, this program is probably going to make you worse. So make sure you get a correct diagnosis. Much like plantar fasciitis, this is probably going to be worst for you in the morning. So that's a good way to be able to diagnose if you're dealing with this Achilles tendinopathy. For this protocol, it's really important to know whether you're dealing with insertional tendinopathy or mid-tendon tendinopathy. If it's mid-tendon, that's where you have pain about 2 to 7 centimeters above where that tendon attaches to the bone. More on why this is important later. If you're new to my channel, I expose the truth about musculoskeletal health to help you avoid unnecessary treatment and surgery. So make sure you subscribe unless you want to find yourself on the operating table unnecessarily. The Alfredson Protocol is a proven exercise regimen developed by Dr. Alfredson that focuses on eccentric exercises which have been proven to strengthen and improve tendon problems. There's 2 main exercises in the Alfredson Protocol. You'll need a step or a raised surface for these exercises. You can use a slant board if you have one, or just a step will do. Number 1 is eccentric heel drop for the gastrocnemius. That's the bigger, more explosive muscle in your calf. Second is an eccentric heel drop for your soleus, which is the less explosive muscle that's deeper in your lower leg. Both of them come together and attach onto the Achilles tendon and insert onto the heel. For the gastrocnemius focus, you're going to keep your knee ultra straight, raise up with most of your weight on the uninjured leg, shift your weight onto the injured leg, and lower down beyond neutral off of a step if you are dealing with a mid-substance, mid-tendon Achilles tendinopathy. If you're dealing with an insertional tendonitis, you want to do this exercise without a step or a slant board and stop when you get back to floor level. The reason is the insertional tendonitis problems have more difficulty because of the increased forces that go on when you drop below neutral. So that's where it's really important to know which of the 2 injuries you're dealing with, mid-tendon or insertional tendonitis. Now what you're going to want to do is 3 sets of 15 for the straight leg, 3 sets of 15 for the bent leg, and do that 4 times per day. That's 180 reps per leg per day. Broken down further, that's 90 per day knee bent, 90 per day knee straight. Don't go as deep again with that insertional tendon problem because the compression forces are higher and it doesn't respond as well. Once this becomes easy, add load by using a backpack or just a weighted vest, and do this whole program for 12 weeks, 180 reps per leg per day. That comes out to 15,120 reps. Now, what if you have pain during or after the protocol? Well, your pain should always stay at or below a 4 out of 10, or what I would call moderate pain. Keep pain in that mild to moderate range when you exercise, and you should do just fine. Recovery from the protocol is extremely important. More on that in a minute. As I mentioned earlier, the recommendation is 12 weeks of this protocol, and you should see significant improvements, if not complete resolution of your problems. If it's not better after 12 weeks, what to do next? Well, a study in 2013 made it clear that you want to do 12 months of rehab before you consider surgical intervention for an Achilles tendinopathy. That's my kind of recommendation. We consistently undervalue how incredible our body is at improving a condition when we give it 2 things: load to the tendon and patience. Now, as I mentioned before, recovery from this protocol is critical if you want it to be effective. You should be back to baseline after 24 hours. Otherwise, you'll need to decrease load or potentially even take a day off. Here's some key tips to maximize your chances of effectiveness with this Alfredson protocol. Number 1 is start slowly. Don't be too quick to add load, especially if you've been dealing with this problem for a long period of time. Listen to your body. As I mentioned, if the pain is going above a 4 out of 10 or you have excessive pain that lasts for more than 24 hours, back off and resume when you're back to baseline levels. Number 3, consistency is the key. Make sure you stick with the protocol and see it through for the recommended 12 weeks. Number 4, stretching. Make sure you are also going through some calf and ankle stretching and mobility work, in addition to just the strengthening program and tendon loading. And finally, number 5, rest is key. Make sure you're getting adequate sleep and you're resting in between your exercise intervention times. Remember, patience and consistency are crucial on your road to recovery. To improve your ankle flexibility and mobility, watch this video. Subscribe for more pain relieving content. Thanks for watching. Keep it moving.